Honorable Director Sir, Principal Sir, Vice Principal Sir, respected professors, mid-level doctors and beloved intern doctors for their presence. Before we begin the session, I would like to request our Honorable Chairperson, Associate Professor Dr. Mohammad Javed Hassan Sir, Head of Department of Nephrology, and our special guest, Professor Dr. Mahfuzur Rahman Khan Chaudhary Sir, Principal of Community-Based Medical College, and Professor Dr. M. Karim Khan Sir, Director of Community-Based Medical College and Hospital, and Professor Dr. M. D. Aminul Islam Sir, Professor and Head of Department of Medicine. Sir, please come on the desk and take your seats. Thank you, sir. Now I would also request our respected speaker, Assistant Professor Dr. Nitai Chandra Rai Sir, Department of Nephrology, to continue this session.
আসসালামু মার্চ মাস থেকে আমরা কিডনি দিবস হিসেবে পালন করি এবং এটার প্রতি বছরে এই দিবসটা পালিত হয় মার্চ মাসের তৃতীয় বৃহস্পতিবার। তাই এবার কিডনি দিবসের যে টাইটেলটা আর ইউর কিডনিস ওকে এন্ড ডিটেক্ট আর্লি এন্ড প্রোটেক্ট কিডনি হেলথ। বাংলা এটাকে বলা হচ্ছে আপনার কিডনি কি সুস্থ, দ্রুত শনাক্ত করুন এবং কিডনি স্বাস্থ্য সুরক্ষা করুন। আজকের বিশেষ অতিথি আমাদের স্যার প্রিন্সিপাল স্যার আছেন এবং পরিচালক স্যার এবং মেডিসিন বিভাগের প্রফেসর আমিনুল ইসলাম স্যার। এখন বিশ্বে বর্তমানে কিডনি রোগীর সংখ্যা অনেক বেশি এবং এটা আমাদের মতো ডেভেলপিং কান্ট্রিতে এর সংখ্যা দ্রুত বেড়ে যাচ্ছে। আজ থেকে 15 বছর আগে এখানে প্রিভ্যালেন্স রেট ছিল 10% প্রতি 100 জনে, এখন এটা বর্তমানে প্রায় মোর দেন 25% প্রতি 100 তে। এবং যতগুলো মৃত্যুর কারণ কিডনি রোগে 1990 সালে ছিল এটার 19তম কারণ, এরপরে 2010 সালের দিকে এটা আরো বেড়ে গিয়ে 10ম কারণ হয়ে গেছে এবং বর্তমানে 2025 সালে 7ম কারণ কিডনি রোগের কারণ এবং আলটিমেটলি 2040 সালে এটা ধরা হচ্ছে যে যদি এটা প্রোটেক্ট না করা যায় তাহলে 1/5 কজেস অফ ডেথ ডিউ টু রেনাল ডিজিজ। যেহেতু এই রোগের কোনো লক্ষণ নাই এবং 80% কিডনি দুর্বল হওয়ার পরে এই রোগের লক্ষণ দেখা যায়, যার জন্য সাধারণত রোগীরা আমাদের কাছে খুব দ্রুত আসে না, যার ফলে এটা ডিটেক্ট করা খুব মুশকিল হয়ে যায়। কারণ 80% ড্যামেজ হওয়ার পরেই কিডনির লক্ষণগুলো দেখা যায়, যখন স্টেজ 5 চলে যায়। যার ফলে এটার মেইন যে বিশ্ব কিডনি দিবসের যে মেইন যে মোটিভ সেটা হচ্ছে এটাকে দ্রুত শনাক্তকরণ এবং সেভাবে প্রপার ট্রিটমেন্ট করা এবং যে সকল রিস্ক ফ্যাক্টরগুলো কিডনি রোগের জন্য দায়ী, যেমন ডায়াবেটিস, হাইপারটেনশন, নেফ্রাইটিস এবং বিভিন্ন ধরনের ব্যথানাশক বড়ি, তারপরে রেনাল ডিজিজ এবং প্রিম্যাচুর ডেলিভারি বা অনেক সময় দেখা যাচ্ছে যে প্রিম্যাচুর ডেলিভারির পরও কিডনি নষ্ট হচ্ছে ছোট ছোট বাচ্চাদের। আজকে সেমিনারের স্পিকার ডক্টর নিতাই চন্দ্র, আমি রিকোয়েস্ট করব নিতাই চন্দ্রকে তার সেমিনার পড়াবেন। থ্যাংক ইউ।
Good morning, Honorable today's Chairperson Sir, Dr. Mohammad Javed Hassan Sir, Honorable Principal Sir, Honorable Dr. Professor Dr. Aminul Islam sir, Professor and Head, Department of Medicine, my respected teachers, my senior colleagues and junior colleagues, and my beloved intern doctors. Very good morning. I am Dr. Nita Chandra Rai on behalf of Department of Nephrology going to present my today's presentation. Today we are going to observe World Kidney Day. This is 20th World Kidney Day. The World Kidney Day was first observed in 2006 as a joint initiative by International Society of Nephrology and the International Federation of Kidney Foundations. The aim was to raise awareness about the kidney health and promote preventive measures to reduce the burden of kidney disease worldwide. Since then, it has been observed every year on second Thursday March, bringing the global attention to importance of early detection, treatment, and lifestyle changes that support kidney health. In 2025, the 20th World Kidney Day was observed globally on March 13th, that is last Thursday. But today we are going to celebrate this day in our institution. The significance of this World Kidney Day lies in its role in addressing the growing prevalence of kidney disease. Day by day, the prevalence of kidney disease is sharply rising, with millions affected globally and many cases going undiagnosed. The initiative focuses on educating the public, encouraging regular testing, and advocating for better healthcare policies. Each year, the campaign follows a specific themes that highlights the key aspects of kidney health, aiming to reduce the impact of kidney-related conditions on individuals and healthcare systems. In this year, the theme is "Are your kidneys okay? Detect early, protect your kidney health." That is, we have to be aware about our kidney health, whether our kidneys are diseased or normal. And we have to detect early our kidney disease and to take the preventive measures to protect our kidney health. The broad spectrums of kidney disease include, on the basis of duration and severity, as acute kidney injury, acute kidney disease, chronic kidney disease, and at the end of this extreme is the end stage renal disease. And all these conditions are very much interrelated and can affect the kidneys in many ways and can transform or progress from one stage to another. That is, acute kidney injury may convert to acute kidney disease that may progress to chronic kidney disease and then ultimately produce the end stage renal disease. The Kidney International Supplements on 2022 reports that worldwide 843.6 million people are affected by kidney disease. That is, approximately 1 in 10 people are suffering from any form of kidney disease. And the very common underlying cause of this kidney disease are the individual may have diabetes mellitus, may have high blood pressure, and it is more prevalent in women and in elderly aged patients. And the large burden, about 80% of this burden lies in the lower and middle income countries. That is, the lower income country and the lower middle income countries bears the most burdens of the kidney disease. And the death rate is very sharply rising since 1990 up to 2017. The death rate has increased by 41.5%, and the death due to kidney disease was in 19th position in 2019, but now it is at 8th position, and it is projected to be the fifth position, fifth leading cause of death by 2040. So it is very alarming that if we cannot arrest or prevent the kidney disease will be the first and foremost cause of death worldwide. It has been shown that 1 in 3 adult patients with diabetes and 1 in 5 adults with high blood pressure may have kidney disease. Approximately one third of the known population with kidney disease living in China and India alone. And the developing countries like Bangladesh face challenges in early detection and treatment of kidney disease. So it is also a great threat for a developing countries like us. About 9 in 10 adult patients with kidney disease do not know about their kidney disease. That is 90% of the kidney disease patients do not know that they have their kidney disease. And it is very alarming. And these undetected and untreated kidney disease are more likely to produce kidney failure and can cause premature morbidity and mortality. And CKD in children has profound additional effect like threatening growth and cognitive development with lifelong health and quality of life implementation. So it is also a very alarming for the child or young age people. Surprisingly, a diagnosis of CKD is often missing in people with documented reduced kidney function. A study in high-income countries showed absence of kidney disease diagnosis among 62 up to 96% of population with laboratory evidence of CKD stage 3. That is, up to CKD stage 3, the patient even not been diagnosed, not been detected, even in a high-income countries. This pyramid-shaped structure image shows the burden of the kidney disease worldwide. Here we can see the broad base of this pyramid ranging from stage 1 to 3 represent the robust amounts of the total kidney disease, and these group do not have any symptom and remain undiagnosed and untreated. And we can see only the stage 4 and 5, that is the tip of this pyramid, that is we can see only the tip of the iceberg, and this is very negligible amount that can come in concern to the nephrologist or the physicians, and the great burden remains hidden. So it is also a very important cause why the prevalence of CKD is growing so sharply. Why the kidney disease or kidney health matters? The number of people with renal replacement therapy, that is dialysis and transplantation, that is the ultimate treatment for a patient with end-stage renal disease, is anticipated to more than double to 5.4 million from 2010 to 2030. Unfortunately, renal replacement therapy, especially dialysis, is unavailable and unaffordable to many low-income countries and low middle-income countries, contributing to millions of deaths annually. In many high-income countries and middle-income countries, only 2 to 4% of the health budget is spent for kidney failure treatment. So CKD confers a catastrophic cost to the individuals, to their families, to the whole healthcare systems, and to the governments worldwide. According to WHO recommendation, Among the major non-communicable diseases, the chronic kidney disease has also been included, and it is very common with very sharply rising prevalence. And it is a very deadly disease having increased mortality rate, and the treatment cost of CKD is highly expensive and ultimately leads to catastrophic healthcare expenditure that is not even can bearable by a high income countries. So it is a very alarming situation from us, from our countries as well for whole world. The burden of kidney disease in Bangladesh. In Bangladesh, around 30 million people develop acute kidney injury each year, and CKD affects 16 to 22% of the population. Roughly 11% of these population have stage 3, 4 and 5. Almost 20 to 200 to 250 per million people, that is 35 to 40,000 Bangladeshi people develop ESRD each year. আমাদের দেশে প্রতি বছর 35 থেকে 40,000 লোক কিডনি ডিজিজের লোক তারা এন্ড স্টেজ কিডনি ডিজিজে আক্রান্ত হবে। And alarming situation is that the dialysis facility, that is the ultimate management for a patient with ESRD, is very limited in our country. Currently available 700 dialysis machine can serve around only 23,008 patients with 2 sessions of dialysis per week. That is, our whole capacity of dialysis can provide only 23,800 ESRD patients, and the remaining patients remain out of reach for the dialysis facility. So, and the most of the dialysis centers in Bangladesh operate for profit, and these are centrally placed. So it is not available throughout the country, and the cost ranging from dialysis per session 44 to 62 US dollar, and those who income profit from dialysis, and for the non-profit it is 12 to 18 US dollar. So it is highly costly for a patient with ESRD as well as their families. So CKD burden is increasing in Bangladesh due to rising prevalence of dialysis, hypertension and lifestyle factors, limited access to the early screening and dialysis in Bangladesh, high out-of-pocket healthcare expenses. So we need for public awareness and policy intervention. This figure shows the very important risk factors for the development of chronic kidney disease. If we divide all the risk factors in 4 major dimensions, the 4 major dimensions are cardiometabolic disease, environmental conditions, socio-economic conditions, and other health-related conditions. Among them, the most important are the cardiometabolic disease that include the diabetes, hypertension, cardiovascular disease, and the obesity. And among the environmental factors, the toxins, envenomation, air pollutions, and climatic change are most important. And the socio-economic conditions include the poverty, poor health literacy, and rural living. And other health-related conditions include low birth weight, pregnancy-related kidney disease, congenital anomalies, malignancy, autoimmune disease, and infections, different types of infections. So we have to ask, are your kidneys okay? So we have to treat. So today's World Kidney Day aware us about the understanding of the importance of kidney health testing. So we have to test our kidneys. To assess our kidney health, Very simple, non-invasive, cost-effective tests for the high-risk populations are recommended, and these includes the blood pressure measurement, as blood pressure is the most prevalent risk factor for the kidney disease. Then the body mass index, that is the estimation of body fat based on the height and weight, and obesity is epidemiologically associated with CKD risk. Then we have to test our urine for albumin, that is albuminuria. A first morning urine sample is preferable. Then urinary albumin creatinine ratio and protein creatinine ratio. Among these two, albumin creatinine ratio is preferable as the most sensitive test. Then we have to go for blood test. Glycosylated hemoglobin, fasting blood sugar, or the random blood sugar to check our status of diabetes. Serum creatinine to estimate glomerular filtration rate and to evaluate the kidney function. EGFR using a combination of serum creatinine and cystatin C is generally more accurate than either any biomarker. However, the facility of cystatin C use is mainly limited to high-income countries and is cost relative. So, if we can measure this proteinuria as well as the glomerular filtration rate, we can stratify our kidney disease at which stage we are standing or at which stage our patient is standing. On the basis of GFR, the CKD stages are 4, stage 1, 2, 3 and 4, 5. So I do not like to go in details of this slide, as the slide is available in all the text and online available. In some specific situation, we have to do some other special test, like testing for hematuria is very important for a patient risk for glomerular disease, especially for IgA nephropathy, and baseline imaging in patient with structural abnormalities to evaluate the kidney mass, kidney stones, cysts, hydronephrosis, urinary retention like this. And genetic testing also may be necessary for a patient with known genetic disease and post-donation surveillance for those who have donated kidneys to assess their kidney health over a long term. So we have to follow a conceptual framework to test our kidneys to risk stratification and for treatment program. All the populations either have a risk factor or not to be tested if they have any kidney disease. So there should be screening. If the kidney disease is confirmed, then they have to make stratification with staging of the kidneys and to know or discuss about the prognosis of the disease and then to initiate the treatment. If the kidney disease is not diagnosed, then they should be re-evaluated after a period of time so that they may not develop any kidney disease. So today our aim is to protect our kidney health. How can we protect our kidney health? Conceptually, there are 3 levels of CKD prevention. The primary prevention is to reduce the incidence of CKD by treating the risk factors already we have discussed. Then the secondary prevention to reduce the progression and the complication in those who have already chronic kidney disease, and the tertiary prevention to improve the outcome in those with kidney failure by improving management such as improved vaccination and optimum dialysis delivery. Among the different preventive measures, the primary and the secondary prevention strategies use the 8 golden rules of kidney health promotion. 5 of these are identical to life's essential 8 rules for improving and maintaining cardiovascular health also. For early detection, focuses on secondary CKD prevention that involves protecting kidney health and reducing cardiovascular risk. So, thus we will able to reduce the mortality. the essential 8 roles to protect our kidney health, to protect our health overall. First, to keep us fit and active. Then we have to regular control our blood sugar level. We have to monitor our blood pressure. We have to eat a healthy diet and to keep our weight in check. We have to maintain a healthy fluid intake. We have to avoid smoking. We do not have to take over the counter medications, and with all, we have to get our kidney function to be checked if you have any one or more of these risk factors. So these are the golden rule to prevent the disease and to protect our kidney health as well as our overall health. What are the potential benefits for the early detection of kidney disease? Early, as the early stage of CKD is very asymptomatic and effective treatment, including lifestyle modification, interdisciplinary clear pharmacologic interventions, can reduce the progression to more advanced CKD stage. So early diagnosis and treatment can arrest the progression of kidney disease. So the end stage kidney disease will not be developed there. And early detection can reduce the healthcare costs, can offer clear economic burden both for high income countries and lower income countries, improve workforce productivity, especially in low income countries and low middle income countries, reduced catastrophic health expenses for individuals and their families. If this early detection coupled with effective intervention, early detection of kidney disease will benefit the individual, the healthcare system, the government, and the economy. So it has very enormous benefit. What are the challenges for implementation of early detection? There are many structural barriers to widespread identification and treatment of CKD, and these are low public and professional awareness for kidney disease, lack of healthcare infrastructure, inadequate policies and resource allocation, inadequate healthcare cost and funding, unreliable testing, shortage of healthcare professionals, and weak health information systems to track CKD burden. So these are the challenges. So how can we make solution of these challenges? We can do it by integrating CKD detection into existing governmental screening system, educating public and primary care professionals, ensuring equitable access to primary health care, particularly in low-income countries and low-middle-income countries. Testing must be affordable, very simple and practical, engaging non-governmental organizations to focus health policy agendas on kidney disease. So these are the solutions, but these are in very far distance. What are the challenges for kidney care in Bangladesh? In Bangladesh, we are facing so many challenges, like increasing awareness of kidney disease, expanding access to early screening, strengthening public health campaigns, addressing the shortage of trained medical professionals, improving access to dialysis in remote areas, reducing cost barriers for kidney disease management, establishing a robust surveillance system. So these are our challenges. For this, we have to develop community involvement and advocacy, organizing kidney health camps and free screenings, promoting kidney-friendly workplace initiative, engaging schools and youth in awareness campaign, encouraging policy making to implement better healthcare policies. In conclusion of today's presentation, early detection and management of chronic kidney disease are crucial for protecting kidney health. Addressing barrier and implementing solution can reduce the global burden of chronic kidney disease. Collaborative efforts are needed to improve awareness and healthcare practices. Only then will the paradigm shifting benefit of lifestyle change and pharmacologic treatment translate to better kidney and overall health for people all around the world. So we hope for the best. Thank you for your patience.